over 4 weeks consecutively, then the nurse can decrease check-ins to biweekly, for a month, then monthly. If the patient is non-compliant at any point, then the check-ins will restart from the beginning sequence of weekly. This specific intervention is being done to establish a habit and consistency of taking medications, fostering self-care for the patient. We are also tracking to be able to identify any issues that come up with medication management and compliance. This is the next section of the correction. In the following paragraph, we will identify relevant health policy implications for the coordination and continuum of care based on precise and accurate interpretations of relevant policy provisions. Medicare and Medicaid insurances for prescription drug coverage requires what is called a PA or prior authorization from a prescribing healthcare practitioner before the medication can be approved, and little is known about their effects on initiating and switching of clinically essential medications, particularly among patients with mental health illness. Liu et al., 2010. A PA is essentially an insurance barrier to obtaining a specialty medication for a mental health patient. In my current field of outpatient mental health intensive outpatient services, this is one of the delays in patient care that happens related to insurance policy and provisions. A recent case occurred last week that had a delay in medications due to prior authorization. The specialty medication in question was Ingrezza, which is a medication used to counteract tardive dyskinesia, side effects like involuntary shaking from antipsychotic medications. The medication was ordered by a psychiatrist, however, the prior authorization takes time to get approved with insurance. Normally, when we call medications that are not specialty into the pharmacy, they can adjust the medications the same day, if not the following day for the patient. When it is a specialty medication with a prior authorization, we can expect at least 2 days delay and up to a week at times. This is detrimental to the patient because they're having involuntary movements that are usually causing distress in everyday life and the functioning of their living. From personal experience, there should be a reevaluation of the prior authorization policy and provisions among insurances, and they should make the appropriate changes to minimize this delay in order to increase the care for the patient. Thank you.